This video is to provide you, the patient, the tools necessary to make the best decision for cataract surgery. Hi, my name is Dr. Vinny Keshav with Boston Vision. So cataracts are a natural process of aging where the natural lens in your eye becomes cloudier and cloudier. Essentially, patients will start noticing more glare at night, especially when driving at night, or they feel like they're unable to read without a lot of extra light, or things in general are just cloudy. Patients often ask me, when should I remove my cataract? And the answer to that is really when it's affecting you. If you're feeling like you're unable to drive at night or don't feel safe doing that, if you feel like your vision is too cloudy to do the things you want to do, then most likely the time is now. Some patients want to wait, and in general, I tell my patients it's okay to wait, but you don't want to wait too long. Occasionally, cataracts become too dense, and at that time, the surgery becomes a little bit more complicated, and you may set yourself up at having complications during surgery, which we obviously want to avoid. I tell all my patients, obviously surgery is surgery, and there are always risks. The main risk of cataract surgery is infection. There's also risk of other complications such as retinal detachment, bleeding within the eye, increased eye pressure. I encourage you to look through the consent that we'll give you. But in general, cataract surgery is a very, very successful surgery, and a majority of patients, more than 90%, are very pleased that they did it. When it comes to cataract surgery, you have the option of choosing how you see. You are essentially choosing a new way of seeing. At Boston Vision, we boil these down to two decisions: where you want to go and how you want to get there. Decision one, where you want to go, meaning where do you want to see after cataract surgery without glasses? That means distance vision, monovision, or reading vision. With distance vision, you are essentially deciding to see for distance in both of your eyes. Monovision is a strategy to reduce the need for reading glasses. That is basically where one eye is set for distance and the other eye is set for reading vision, and your brain has to adapt to that. As you can imagine, it's not a perfect solution. However, a majority of patients who choose this option feel like they can essentially do a majority of their tasks without always reaching for their reading glasses. There are certain instances where you may need reading glasses or distance glasses, such as nighttime driving, or if you're looking at reading really fine print. The other option is reading vision in both eyes. With this option, you will be able to read consistently without the need for reading glasses, but you will need distance glasses. Decision two, how do you want to achieve this visual goal without glasses? Option one is what's covered by your insurance or whatever co-insurance you may have. With option one surgery, I'm doing that by hand and implanting a standard lens. That lens is going to give you good distance vision, depending on what you choose, about 70 to 80% of the time, depending on your eye. Option two is something called a laser-assisted cataract surgery. With the laser, we are able to do the cuts that we normally do by hand. So as you can imagine, it's much more precise. It's marginally safer. And in my hands, I feel like it does make a difference. It makes my job much easier. With option two, we're able to achieve your visual goal about 90% of the time. Option three is something called a light adjustable lens. As you can imagine, as the name implies, this lens is adjustable, meaning that we can do some tweaks to the lens to fine-tune your vision after the surgery. The lens has a minimum of 3 adjustments so that you are more likely to achieve the goal of getting the vision that you want. With this lens in our practice, we found that patients are able to achieve that 20/20 vision 99% of the time. The last option is option 4, a multifocal lens. This lens is designed to give you vision for distance and reading in one lens, so different than monovision where one eye is doing distance and the other eye is doing reading. This lens is designed with rings in the lens, and each little ring has a different focal point, and that's what gives you that multifocal vision. Now, it's a new way of seeing. A majority of patients adapt to this lens really quickly and get it right away. However, some patients don't, and they take many weeks to many months to actually adjust to this. Other downsides is the lens may cause halos at nighttime, and unfortunately, there's no way of knowing who's really gonna see these before the surgery. The only way of knowing is by actually doing the surgery. Patients ask me all the time whether these other options are worth it to pay out of pocket, and really depends upon your goals. Option one is a great surgery. You're gonna see better either way. You have a visually significant cataract. However, if your goal is to see as best as possible without glasses, then we have these options available to you to try to achieve those goals. So patients also ask, why Boston Vision or why choose me? You do have the option of going anywhere you want to. At Boston Vision, I believe that we have the best technology. We reinvest what we do in getting the best technology. We're always attending new conferences to see what's new and available, and therefore we're able to pass that on to our patients to achieve better outcomes. I hope this video was informative to you and helped you make the decisions that you need for cataract surgery. Once again, my name is Vinny Keshav, and I hope to see you soon.